I'm going to talk about my experience in the use of those two different kind of technology, radiofrequency and laser, over this area. My conflict of interest, and this is my tools or my toys. I use every day a CO2 laser, a quick switch laser, IPL, Fox, diodo laser, and platform of radiofrequency. These have two phrases on my mind all the time in a complete fight, and I need to ask to the patient not only about his expectation, at the same time he's prepared for prolonged post-treatment recovery time and worse post-treatment recovery time. Better result, of course, but in my hand is with CO2, but if you have the patient that concerned about these two situations, the worse and the prolonged post-treatment recovery time, and he preferred a gentle way, I prefer, for example, the use of microneedle. But need to discuss that in the first appointment to be sure don't have any problem after that. When I mentioned the skin improvement, I started mentioning the iron effect. I can do that by CO2. It's similar as you pass the iron over a t-shirt or a shirt at home. And I obtained that because I'm really aggressive. I perform a stacking mode 2 or 3 times in the same dot, and I act with the overlapping 50% of the previous area with the 50% of the next area. To obtain this kind of result, as you can see here, I was able not only to erase the pigmental lesion, at the same time I reduce a lot all the wrinkles in the periorbital area. Another patient with great quantity of wrinkles and folds, and the way we can fix it up. And one of my best cases, the patient that I performed a plaster facelift in the past, she requested for another one. I said, no, stop. You have a complete indication for CO2, and this is my result after 2 sessions. As you can see here, I was able not only to reduce the wrinkle, reduce the fold, and at the same time shorten the length of the skin in the upper eyelids, and get improved in tear drop too. When I mentioned the laser and radiofrequency blepharoplasty in my hands means without surgery. I never go to the surgery room with my devices. This patient had a complete indication for a surgical procedure, as you can see here, a lot of wrinkles, in the lower eyelids, excessive skin in the upper eyelids, fat pads. I decided to use only CO2 with this parameter, several pass, stacking, and overlapping mode. This is the situation after a month, and this is the new situation after 6 months. As you can see here in the compare photos before and after, and if we can put the focus over there, I was able to erase this wrinkle. Of course, if I perform a plastic surgery, I can obtain better result, but it's without the surgery. And notice that after a year, she's stayed with me as a patient. You can have at least one part of the improve, and after 2 years, she still have one part of the improve. A patient with 80 years had a lot of contraindication for a surgical procedure by the age, by his health, and by his relationship, because they don't want to send her to the surgery room to avoid any kind of risk. That's why I applied the CO2 and obtained not only the erasure of the wrinkles, at the same time, look the tail of the eyebrow, in which way I change the positions. I lift it up. From view, the same result. And I can perform that. I mentioned the stacking mode. I put the handpiece in the temporal area and apply several passes and several times in the same dot to obtain this contraction of the skin and change the position of the tail of the eyebrow. Even in younger patients in the close to 40s, with this excessive skin in the upper eyelids, I can obtain a contraction of it. This patient is not good enough result, but the best is, you can see here, after 2 years, we still have an improvement in the area without any other kind of treatment. Radiofrequency blepharoplasty means to me, well, here I first apply a fractional device. That way I obtain an ablation of 150 microns. That's why it's really safe to perform again stacking mode over try to looking for the rim of the bone in the orbital area to be sure don't hurt the eyes. And after that I apply microneedle with a dip of no more than 1.2, 1.3 to be sure all the energy go inside the skin, go inside the dermis. to obtain this kind of result. As you can see here in a close view, I was able to reduce the quantity of folds and wrinkles in the upper eyelids and shorten the length too. Another patient that is dissatisfied with my surgical procedure, and this is true, I was not good enough to solve the sagging skin on the upper eyelids. I have two possibilities: return to the surgery room or apply technologies. I applied this combination of fractional and microneedle. I shortened the upper eyelids, and the patient is really agree with me. When you have an IPL and you want to have better result on your treatment, aesthetic treatment, I give you the advice to add 5-aminolevulinic acid, 5-ALA, to obtain this kind of result, because you getting more improved in the area, better results. Not in some cases you can add only with the IPL. Laser peel or Hollywood peel, fortunately for us, there's a lot of info in the media. The patient requests directly for this kind of treatment because it's really gentle, only take 2 hours of rednesses, no more than that. And they request directly with this trademark name. It's faster, easier to do it. You apply a carbon solution, then you apply any kind of Q-switch laser, don't need to have a pico or nano specific, and you can obtain this kind of result. They improve not only about the pigmental lesion, of course, but at the same time, reduce the size of the porous and bring some glowing to the face. The layer B effect, as you know, is made by the Q-switch laser, especially with picosecond laser. You can obtain vacuolas, you can make holes inside the dermis by this disruption made by the photoacoustic effect, and our body notice what hurt and fill it up these holes with collagen cell and elastin too. In this way we can make it thicker and more healthy. As you can see here, not only about the ratio of pigmental lesion, and the same time get improved in the quality of the skin. And this is the patient that I showed you a few seconds ago to compare before and after of the treatment of acne sequelae only by the layer B in a close view, and take the color of the photo to measure better well the result. Vascular lesion, yes, we have vascular lesion, we have pore white stain in this area, and this is the quality of improvement we can obtain with IPL. Again, with IPL, even rosacea in this area can obtain, really get improved with IPL. When you mention pigmental lesion, I prefer the use of picosecond devices to obtain this kind of result in melasma. Over lentigos, burn marks, dark cycles, and otanevi. It's a complete indication of Q-switch laser for otanevi. Tattoo removal is not so often in this area. We mentioned about the cosmetic tattoo, only that. About laser surgery, the use of santelasma for transdermal is the better indication. As you can see here, with only 2 sessions. On my hand, as a plastic surgeon, I can obtain a great result as I can do it with the CO2. And finally, my new indication, all of us know how can improve or can resolve an aesthetics, over filler or with hyaluronic acid. But if you have this problem with fat cells, you need to go to the surgery room or do that. You apply laser diodo, in my case, diodo 980. You can use 1400, for example, and you can melt the excessive fat cells anytime you want, a session that you want. You can reduce time by time, step by step, and this is the situation. The patient, after only 1 session, she agreed with that. She stopped to calling my colleague because there is a problem for a colleague of mine, and we all are really happy with the result. My take-home message: medical technology are the best assistant for the plastic surgeon or any kind of aesthetic medical doctor at the office. They are a tool during the patient appointment because you can suggest surgical and non-surgical procedures. It depends on the expectation of the patient. And of course, this is a great message for my colleague, plastic surgeons. Solving skin is not the same to solving skin quality, not always a matter of cutting. Thank you so much.